Of course, that is not always an option for people because maybe at the time they're beginning hormone therapy, they're really have low financial resources, don't have the ability to invest in fertility preservation. Also, for some folks, there's real urgency around beginning hormone therapy. I know with some of my own clients, they wanted to begin hormone therapy 5 years ago. And so even thinking about delaying this process longer to preserve fertility feels totally impossible. And for folks who haven't preserved fertility before beginning hormone therapy, but decide at some point that they may want to, pausing hormone therapy is an option. For folks with testes and sperm, this entails discontinuing any androgen blockers, discontinuing estrogen for a few months, attempting ejaculation, determining whether there's any healthy sperm, and then either freezing that for future use or using it immediately, or of course, even engaging in intercourse to conceive at that time. This is an option. Obviously, it could cause really significant distress or anxiety or dysphoria for some folks. I just wanted to, why is this section even in this presentation? Obviously, none of us are our clients' fertility providers. But at least I know in my experience with a number of my clients, I might be the only person who is talking to them about fertility preservation as they're considering their transition. Or one of my clients, did get a brochure at the time of being prescribed hormone therapy, but got no other information about fertility preservation. And so you may be the people having these conversations with them. And I think there is a role that we as therapists can play in supporting clients who are maybe pausing hormone therapy to go through fertility preservation, perhaps by coordinating care with the cryobank they're working with or with the fertility providers they're working with, doing a little bit of screening on the client's behalf for gender inclusivity, maybe providing some guidance to those providers around just what to look out for, what some of the mental health impacts the client might be experiencing while off of their hormones in order to engage in this process. And then for folks with uteruses and ovaries, there is actually a growing body of research that suggests that the effects of testosterone on fertility are temporary. And so if gender-affirming hormone therapy is discontinued and menstruation resumes, fertility, the ability to conceive, is assumed for trans folks who stop hormone therapy. This obviously does require pausing hormone therapy, and menstruation takes anywhere from a few weeks to 6 months to resume. And then obviously folks do have to stay off testosterone for the duration of the pregnancy, just because currently the unknown effects of testosterone on the fetus. So I think is worth naming that transmasculine folks, non-binary folks with eggs and uteruses who have used hormones can create and carry healthy pregnancies and give birth, and they can also do so using their own eggs in another person's body, as is the case of reciprocal IVF. So we're going to spend a few slides here on some pregnancy and postpartum specific considerations for queer and trans folks. And then we will move into that section on fostering and adoption that I keep referring to. So obviously pregnancy comes with body changes that could be distressing to most anyone. I think that this could be particularly disconcerting for some queer and trans clients. We sort of named that there can really be this stress and grief around not being seen as the child's parent, not being able to carry the pregnancy, or feeling some dysphoria around the fact that your body is not able to participate in conception in the way that you desire for your body to. So we just wanted to highlight some ways that folks might go about reducing dysphoria and also increasing euphoria during this period of time, which I think are valuable for us all to know to support clients in that process. So gender dysphoria here being, the feelings of discomfort that are produced when someone's experiences do not align with their gender identity. A few things we wanted to name were, for example, suppressing lactation after giving birth for somebody who experiences chest dysphoria, for whom lactating from the chest might be a dysphoric experience. or perhaps for somebody giving birth who experiences bottom dysphoria, for whom giving birth via the birth canal would be dysphoric, arranging for a planned C-section. I think sort of our role here might be in just giving clients permission to give themselves permission to choose the options that decrease dysphoria for them and make pregnancy a less distressing experience. And then also just want to note, like, pregnancy clothing and products are obviously really highly feminized, which can be pretty alienating for folks whose gender identities and expression don't align with that experience. And so supporting clients in this period of time, pregnancy, postpartum, might be just consistently reiterating their right to authentically express themselves and to look however they are and need to look during their pregnancy, and that they can wear the clothes that are most comfortable for them. So just really getting back to prioritizing authentic self-expression. And then I think it is just also worth naming that that pregnancy could actually be an opportunity for some folks to affirm their gender identity. It might be a way to experience gender euphoria being sort of the opposite of dysphoria, the joy, the satisfaction, the pleasure that one might experience when their experiences align with their gender identity. So for example, we listed here, maybe for a non-gestational parent who really desired that experience of carrying a pregnancy, how might they use baby wearing to increase their euphoria? And also sort of the use of inducing lactation to experience breastfeeding for folks who want to have that experience. That could be a rather gender-affirming experience for someone. So I just want to name that. And since we're on the topic, we'll jump into human milk feeding. I know I've named this a number of times now, but a number of folks might really grieve the experience of not being able to have conception or pregnancy happen in their body with their gametes. And I think that milk feeding is actually one of the areas where there are options to support people of all genders in feeding and connecting with their babies. So naming a few here, highlighting ways that non-gestational parents in particular have options for feeding baby. I'm using the language chest feeding sometimes interchangeably with breastfeeding to sort of be inclusive and reduce dysphoria for folks who relate to their body as their chest and not their breast. And so we are using the language chest feeding there. It is worth noting that trans men, even post-top surgery, even while taking testosterone, may have the ability to lactate or induce lactation. Very likely that they'll have a reduced supply and will need to supplement in some way, but that experience is very much possible. Some couples, partners might choose co-feeding. So perhaps the gestational partner is breast or chest feeding, and then the non-gestational partner is maybe also breast or chest feeding, either by engaging in relactating efforts or inducing lactation. I've sort of mentioned inducing lactation here a number of times. This is possible for trans women, for trans men, for cisgender men, for people of all genders, could actually engage in inducing lactation. There are sorry, what is the word I'm looking for? Lactation consultants that specialize in supporting folks in inducing lactation. So just wanted to name that. And of course, the use of supplemental nursing systems. So these nursing devices consisting of a narrow tube connected to a bottle, so that folks of any gender, and regardless of whether they're lactating or not, can participate in feeding baby at the nipple if desired. So I think there's actually quite a few options around feeding that can affirm people's gender and give them sort of experiences that they might not otherwise have. And just wanted to highlight these couple of resources. This linked to one here by the Australian Breastfeeding Association. That's a 125-page guide for gender diverse people on lactation, and it's amazing. I was very impressed by it. And then also this book that there's a picture of on the left here isn't even out yet, comes out in February 2025, but it is a guide for queer and trans folks on lactation. So I wanted to just feature it here. I'm going to jump into a few more resources next, and just want to name as we do that we are going to be sending out a sort of resource guide. So any resources that we mentioned throughout this training will be all compiled for you in one place with nice little headings. So you'll be getting all that shortly. So yes, just want to highlight a couple of more resources here for you to maybe offer to clients who are trying to conceive. So on the left here, these couple of organizations: Pregnant Together, Rainbow Families, Queer Birth Project. These are all organizations that offer workshops, support groups, online forums, communities for queer folks from preconception through early parenting. So yeah, I wanted to highlight those. I think it's Pregnant Together has like some classes on how to choose a sperm donor, how to prep for birth as a queer and trans person. So yeah, I wanted to highlight them. In the middle here, just have some example of at-home insemination aids. On the left, that's a product called the Pop by Tantus. It's an ejaculating dildo that was specifically designed for at-home insemination by a lesbian woman who worked in fertility medical sales. And then when she was trying to get pregnant at home with her wife, realized there was really nothing fun on the market to help them get pregnant at home. And they designed this together. So this product can be used for at-home insemination. The product on the right there is also an FDA cleared at-home insemination kit that is available. And then lastly, these two books here, Baby Making for Everybody and Queer Conception. These are both books by queer and trans midwives that offer really comprehensive and quite warm guidance on conceiving for LGBTQ folks. I referenced both of these books quite a bit in the creation of this presentation. And then also wanted to name some resources that are more specifically for trans and non-binary folks who are trying to conceive. So Trans Fertility Co. is an organization that really compiles all the latest research on trans fertility. And then Fertility IQ, you may be familiar with, is a family building education resource. They provide a lot of free classes, a couple of particular ones that I think are really relevant to clients. They have a trans feminine fertility and a trans masculine fertility course. And they're like presented like to the client, like it is very much a client focused presentation, largely on fertility preservation. I have sometimes just sent the links to these courses directly to clients who are starting to ask questions around fertility preservation before hormone therapy. So I wanted to name that. In the middle here, just highlighting an all gender birthing class and also a support group, trans and gestating support group. These are not like local resources, but they are virtual peer support spaces. So things that folks can access regardless of their residency. And then lastly, on the right here, found this truly amazing resource guide called the Trans Affirming Perinatal Resources Guide.